are many reasons people will look back on 2022's three Tory governments and say, we've never had it so bad. The PANTO horse with two arses that was Boris reigning, then resigning over Partygate. The 40 days of Liz Truss's economic flatulence flatlining an already faltering economy. But ironically, in a year jam-packed with Tory buffoonery, cronyism and malice, it will likely be the inaction towards our healthcare crisis by the latest incumbent pilot of this Tory government's final death spiral that is remembered best, as the 12-year Tory austerity hatchet job to our public services comes to an ugly head. A government-commissioned paper by healthcare think tank the King's Fund concluded a decade of neglect by successive Tory governments has weakened the NHS to the point that it will no longer be able to tackle the 7 million strong backlog of care, pinpointing David Conneran's decision to cut Labour's previous annual 3.6% NHS budget increase to 1.5% as the key reason for loss of capacity. The Tories call this a COVID backlog, but it stood at 4.4 million in early 2022 before the pandemic. The three wicked witches of the Westminster, Sunak, Health Secretary Steve Barclay and Chancellor Hunt, want to tell you that nurses and ambulance drivers are striking solely over pay. In reality, this month's action has been boiling in the Tory austerity cauldron for 12 years. Behind the smoke, mirrors and curtain, the reality is NHS workers who have dedicated their careers and lives to the provision of universal healthcare to the people of this country are fighting for its very existence. Here's Dr Emma Runswick, Deputy Chair of the Council for the British Medical Association, the Doctors' Trade Union, describing the level of damage the Tories' austerity spell has cast upon the health services frontline care.
We're now getting recurrent reports of spillover from A&E into the corridors, including in some places in the northwest where I work, where they've allocated spaces along the corridor or doctors and nurses to nurse and treat along the corridor. So they will say, oh, such and such a patient is in corridor space 12. So it's not what patients deserve. It isn't the dignified care that we would want them to get. And that's a kind of symptom of backup all through the system. And it's one of the reasons that we're seeing so many problems with the ambulance service, where they can't offload their patients from the ambulance into the hospital, because we haven't got any space for them inside the hospital. And that's a backup from the social care crisis. So we're seeing it all through the system.
The last comparative study of healthcare spend between the G7 developed economies in 2017 found UK healthcare spending per person was the second lowest. The Tories' attempts to portray this as an affordability issue is about as real as your average panto backdrop. An Amdram attempt to mask their stage-managed 12-year attack on our NHS. However, broader government incompetence is clearly also a factor, illuminated by the fact we are the only G7 country to have a smaller economy than before the pandemic. Is it any wonder Sunak's ability to manage a growing healthcare crisis, with doctors almost guaranteed to join their colleagues and vote for their own strike action in January, is about as much use as a panto horse with two arses?